Hi, everyone. I am Dr. Diane Hayden, publisher of Essential Naples magazine, and you are listening to the Dr. Diane Show. Each time on the Dr. Diane Show, we have local experts from Southwest Florida discussing cutting edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited to welcome today Jenni Berman. She's the owner of Berman Health and Wellness and works alongside Berman Physical Therapy in Naples to help individuals get back in shape, stay active, and to stay feeling young so they can stay in the game. She's a physician assistant by training, but her primary focus is wellness, nutrition, and exercise. She is a certified personal trainer and certified nutritional specialist. Jenni helps individuals reach their goal weight and optimize their gut health while avoiding needless medications and achieving the highest quality of life imaginable. Her goal is to evaluate the metabolism, gut health, and blood work to optimize each aspect of the client. You can learn more about her at www.bermanpt, that's B as in boy, ERMAN, P as in Paul, T as in Tom.com/wellness, or you can call their office at 239-431-0232. So welcome, Jenni. Thank you so much for being with us today. How are you?
I'm great. Thank you so much for having me. We're
Awesome.
excited to be here.
Cool. So you have a fantastic article in our summer issue of Essential Naples that's out right now, as we're doing this recording, called Our Gut is Our Second Brain, which I think is a really fascinating title and subject. And I'm sure people read that and think, wait, what? Like how
Right. How do
how is
we
that
have two
even
brains?
related? Yeah, exactly.
What does that even mean? So, and it's true, a lot of people don't understand initially what that means. And so, of course, the article does go into explaining where I came up with that, but it's something we say regularly in our practice. We have to get our gut healthy for our whole body to be healthy. For the gut, for the body to perform the way it's supposed to be as efficient as it can, to make sure inflammation is at its lowest point possible, we have to keep the gut healthy. So I think of that as the second brain. If our brain isn't healthy, the body's not healthy.
Yeah, exactly. And I think there's a lot of research coming out now. I mean, I'm seeing things related to how gut health affects things like depression and mood and anxiety, and really the interconnectedness between the brain and, obviously what we're putting in our body as far as food and nourishment, but also just how we absorb things. And when you think about it, it does make perfect sense, right? I mean, if you're not absorbing critical nutrients and vitamins and minerals and things like that, then it's going to affect a whole ton of physiological, aspects of the body for sure.
Absolutely, 100%. That's one part of it, is the absorption of our vitamins and nutrients through the gut that we need to support our brain, to support our heart, our muscles, in everyday life for longevity. But the other side of it is, if the gut is broken down, meaning the intestinal lining itself, through the entire intestinal tract, our stomach lining, if that's broken down, we're actually allowing particles, so food particles, bacteria particles, to seep into our tissues, and it penetrates the tissues, it gets into the bloodstream, and that's not normal for the body either. So that's creating that response our body has where the immune system is reacting.
Right. Yeah. Yeah. It's really fascinating. And when I do these podcasts with, with our practitioners that we work with, I'm always curious about how you got involved in doing this, like a little bit about, I think our listeners are also just curious about learning a little bit more about you and your
Sure.
background. And of course, we read your bio, but how did you get involved in doing what you do and, leading into now doing it more specifically, let's just say treating this particular type of issue? Was that something you were always passionate about, or has it kind of like evolved?
It definitely has evolved. I grew up as a gymnast. I wanted to be in orthopedic medicine just because I had dealt myself with so many injuries. I knew I wanted to go into some type of orthopedic style medicine, whether it was physical therapy or to be a physician assistant and go into the ortho field. And actually, when I was in PA school, I got very sick and was hospitalized. I was bouncing from gastroenterologist to gastroenterologist with GI issues, really having a lot of intestinal issues myself. I was hospitalized. I was very unhealthy, very lost a lot of weight, was losing my hair. So
Wow.
I went through a ton of things myself, and none of the doctors could give me any answers. They were just handing me pills, take this medicine, take this medicine. At one point, I was up to taking 21 capsules a day. They seem to have been working enough to keep me healthy enough to continue to go to school and be out of the hospital. But when I found out that I was going to have to be on these medicines for the rest of my life, a 24-year-old, very healthy individual that exercised every day, I said, this isn't the answer. 21 capsules is not the answer to figuring out these problems, but nobody else had any other answers. And so actually my husband now, my boyfriend at the time, and I started digging and trying to research more on our own. We were reading books and learning more about Eastern type medicine. Obviously, Western medicine wasn't helping me. And it actually, long story short, came down to I had a very severe gluten sensitivity with gluten itself. And with it took months, but with removing gluten and practicing some gut healing techniques, I was able to get myself going back in the right direction. And later ended up finding out I also had a dairy sensitivity. So once I was able to remove those and do some gut healing, it completely changed my life around. I went from being confined at home or somewhere where I knew where the bathroom was and being very weak and ill to getting my life back. And to fast forward a little bit, graduating PA school, I went into the orthopedic world and decided, I really want to be where I'm passionate about, which is helping others get through what I went through. And actually found a position here in Naples, Florida with a functional medicine doctor, Dr. Carolyn Cedarquist, and practicing medicine with her just completely changed my aspect of medicine in general.
Yeah.
It was wonderful.
It's amazing. I mean, I can't tell you how many practitioners I've heard a similar story from. I mean, literally it's almost like so many have had some type of health challenge that they had to get through
Right.
themselves and completely were failed by traditional medicine and had to figure it out themselves, do their own research or go find a natural medicine practitioner to even do the right tests or even ask the right questions and things
Right.
like that. It's really, it's amazing. And I actually have a friend who has been battling with she still doesn't know what it is, but there's some definitely gut permeability issue because when you said you were like confined to the house, like that's how she is sometimes. She won't travel. She doesn't like to go out to restaurants because she's afraid of what's, even if you ask, like, is there this, that, or the other thing in there?
Right.
You can't be 100%,
Sure.
sure that something, slips through, whether it's gluten or something that you could potentially be allergic to. But it's like, it's so debilitating because you just like, good thing she works from home. Like,
Right.
but
It is.
yeah,
It's life-changing. It's debilitating. It's depressing. I mean,
yeah,
because you go from being so independent and active to not being able to. And yeah, it's, unfortunately with where Western medicine is right now. And Western medicine is great for saving lives. Like there's nothing wrong with Western medicine, but they don't have the time or the insurance reimbursement, unfortunately, to really evaluate the problem, figure out the problem, not just treating the symptoms. And, that's what my husband and I told you, we have a podcast that we podcast on about every week is treating the problem, not the symptom.
exactly. Yep. Yeah. You got to get to the root cause of what it is.
Correct.
And that can be difficult sometimes. I mean, people, if you're not in this field, you may not even have heard of or know what, a food elimination diet is. And like you were saying, you had to go through, eliminating gluten and then dairy and things like that. I mean, it's interesting that when people think about allergies, they don't necessarily think about food as an allergy.
Right.
And I'm not talking like, anaphylactic shock type of food allergy. It's more like a sensitivity, I guess, where you can have all of these, crazy symptoms and not even realize it's because of what you're eating.
Correct. And, I'll kind of go off of what you just said sensitivities and allergies, we can have both, but we can have the same type of reaction response to a sensitivity as an allergy. So sensitivities can be just as severe and debilitating, like we've said already, as actual allergies can. But again, like you said, getting tested for those, or to have the doctors actually think about that being the root cause of somebody's rheumatoid arthritis or lupus or Hashimoto's, thyroid disease. Unfortunately, it's not talked about enough that these autoimmune conditions, IBS, celiac, they all start in our gut, whether the symptoms are migraines and headaches or joint pain or actually having GI issues. The effects of sensitivities can be systemic, meaning head to toe, inside to outside.
Yeah, I want to get into that. Let me back up just a minute though. So let's just talk about what we mean by gut permeability. So what actually is happening in the body? I mean, people have heard the terms leaky gut or, these types of things, but I'm not sure that people really truly understand what is actually happening.
That's a great question. So leaky gut and gut permeability are terms used interchangeably, but basically what it means, as I mentioned before, where the gut lining gets broken down. So the intestinal structures on the inside are damaged, broken, and it actually creates holes in the intestinal tract. So the intestine should be nice and closed, very strong, but over time with these sensitivities or allergies or stress on the body, they open up. And so food particles that we're consuming, particles in the intestinal tract, good bacteria, bad bacteria, these particles actually seep through to our tissues. They seep through into the bloodstream. And that's where the leaky word comes, because the particles are leaking out of the intestines, where really we should consume a food, we absorb the nutrients, and we expel it. That should be the natural pattern. But when we have those holes in our intestinal lining, the food gets through into the blood, it seeps through, it leaks through. And that's not normal for the body. The immune system has to respond to that because we now have foreign bodies in the intestinal tract or in our tissues. We have foreign bodies in the bloodstream that shouldn't be there. And that's where the immune system starts to react.
Right. What are some classic symptoms, just so people might be able to relate to this?
And that is a very tough answer,
Right.
question to answer, because it can be systemic, meaning, you and I can have the same exact food sensitivity. We can both be sensitive to gluten, but we have completely opposite reactions, meaning, I could have constipation or diarrhea, meaning gut issues, abdominal pain, bloating, but you may be having migraine and vision changes, and
Yeah.
that actually is the case. My sister and I both have very severe gluten allergies, and hers was migraines, mine was GI. So some people may experience migraines or headaches, vision changes, joint pain, abdominal pain or bloating. Thyroid disease is a very common one that comes across with food sensitivities as well. Eczema or psoriasis is very common. Certain foods can actually cause flaky skin, red bumps on the backs of the arms. So, it's difficult to answer that in one word or one answer because it affects, head to toe. It's basically, if you have some type of inflammation and it's presenting in one way, it could be food that is causing that.
Yeah. I asked that question specifically because I wanted to give, people some general idea of how it might present, but also because I have an interesting story that happened to me that I wanted to bring up because it was something that when you hear it, you're gonna be like, oh my gosh, like no one would ever guess that this is probably, well, you might because you're the practitioner, but nobody else had any idea what was going on with me. But I basically started having this issue where one of my eyelids was getting like a little swollen. At first, it wasn't much of anything, but like a couple weeks went by and certain times, and I wasn't tracking anything, so I couldn't really pinpoint what it was. But it got to the point where at one point my eyelid was so swollen, my eye was almost shut, like my whole
Right.
lid, and not itchy or anything, just like puffy and swollen. And I'm thinking, oh my gosh, it's got to be like my mascara or my makeup. So I'm throwing out everything.
Mm,
Changing, like, I changed everything related to a personal care routine. I changed soap and face wash and face lotion. And granted, I use like pretty, really clean stuff. So I'm
sure.
thinking this is weird. Like all of a sudden I develop an allergy, but who knows, right? So after I went through all of that, I'm thinking to myself, and it still kept happening. And it wasn't every day, it was random. So now I'm thinking, okay, because of my knowledge, I'm like, it's got to be something I'm eating. Like this is a
Sure.
weird way for it to present itself, but it's got to be. Well, I started thinking, what am I doing differently? Well, sure enough, people are going to laugh at this. Over the previous like 6 months or so, I had started drinking a lot of hazy IPAs.
Yes, I was going to, that was the first thing that came in my mind.
That's funny.
Alcohol.
Yeah.
Yeah,
And it was kind of out of the blue. I'd never been a beer drinker, but my boyfriend's, big into New England hazy IPAs. And we had, this started happening in like September. So over the summer, we've been going to a bunch of different breweries.
sure.
And little by little, as soon as I cut that out, went away.
Right, right.
Stopped it for like 2 or 3 weeks, tried it again, came back. I'm like, okay, I got my answer. Like that's what it is. But honestly, like it took me a while to figure that out because I'm
Right.
thinking it's got to be topical.
Right.
No.
And that's when people say, well, I've always eaten that and never had a problem with it. Why now? And it's true, you can do things for so long before the body gets to a threshold or a, a range of inflammation where then we start reacting. And very commonly it's a stressor or traumatic event, whether it's physical, emotional, internal, some type of stress on the body gets us to that threshold where we then start reacting. So for you, it could have been a buildup of the yeast or a buildup of the gluten, and something stressful happened that triggered that. And just to kind of go off of it, not to say alcohol is the worst thing ever, but alcohol itself can actually cause a cortisol, which is a stress hormone response in our body. And cortisol itself can actually damage the gut lining. So that's why there's such a close relationship between stress and food sensitivities presenting themselves.
Yeah.
So it's
Yeah.
interesting.
It is. It really is fascinating. And it was, like very frustrating because, I thought I had figured it out and nothing was really working until finally I was like, wait a minute. It's not happening every day. It's kind
Right.
of random. Oh, it's actually happening like on a Sunday or a Monday. What am I doing over the
Right.
weekend?
Exactly.
Yeah.
Exactly.
Yeah. Funny, funny. But like I said, I think it's important to tell people about because it could be such a random thing like that. Who would think like, you think maybe you got bit by something or,
Right.
a swollen eyelid to me is way off from thinking it could be related to food. But yeah,
Sure.
it really can manifest in any way.
And you wonder, how could I have four of them and it happens one time and not the next time, so that's what makes food very difficult too, is a lot of times it's that compounding effect. What are you combining it with that's causing it? And that's where figuring out food sensitivities or allergies can be tricky.
Yeah, definitely.
Yeah.
So you mentioned that when we have leaky gut and things are leaking out of the intestines, and now our immune system has to take care of that. Is that why these gut health issues are related to autoimmune disease, or is there some other connection?
No, you're 100% correct. And the reason being is when our immune system is constantly reacting to the inflammation from the gut and the bacteria and the toxins penetrating our tissues, the immune system shifts into an overdrive. It's constantly working and functioning. Our cortisol or that stress response is constantly heightened. And that's where autoimmune takes place. Autoimmune basically means the immune system can't differentiate between a normal cell and a inflammatory cell. And so we start attacking our own organs because of the amount of inflammation and inflammatory cells in our body. So most definitely our gut health is directly related to autoimmune diseases. And again, systemic. It doesn't just have to be celiac or gallbladder disease or irritable bowel syndrome. It is autoimmune disease affecting us head to toe, inside to out.
Mhm.
due to the immune system.
Right, right. And what other issues can arise from just having poor gut health? Can this lead to other diseases or other complications?
Absolutely. And this is very loaded, but certainly having our poor gut health because of vitamin deficiencies can actually lead to Alzheimer's and dementia, can lead to having pre-diabetes, diabetes, or something we treat very often, which is the precursor to those, is insulin resistance, where our body's not metabolizing efficiently. We have weight gain. We're not breaking down carbohydrates and sugar, so our blood sugar goes up. That's very directly correlated to inflammation and vitamin deficiencies. Certainly, if we have vitamin deficiencies, it affects our sleep because of magnesium, and melatonin production is very poor. So affecting our sleep, our energy level, our nerve function. The nerves really need B12 and certain B vitamins, and those break down as well when we're lacking this absorption. Iron deficiency. I mean, I could go
Yeah,
on.
we can keep going.
Yeah.
It's pretty important.
But yes, to answer your question, like it affects our longevity throughout life because of the amount of inflammation we're holding on to and how it is affecting our organs. If you think about it, if you sprain your ankle and you're walking on a sprained ankle, that inflammation and that swelling never goes down. The ligaments aren't working the way they're supposed to. It starts to degrade the muscle, or the muscles and the bones, because of that swelling. So think about that swelling around your swollen fat ankle inside of your body. That's what it's doing to the rest of your organs, your kidney, your liver, which are necessities, the heart. That's where we get high cholesterol and risk of heart attack and stroke because of inflammation itself.
Yeah.
So it's just, yeah.
It is amazing. And I mean, hopefully more and more people are realizing how important it is, what you eat, and that, even once in a while having fast food, or once in a while, or in many people, it's not once in a while in terms of restaurant eating, but even like regular restaurant eating, it's to me, you just have no idea what you're getting. And while nobody probably wants to have to cook at home every night, when you think about it from this perspective, as to the fact that, simple things like your diet, it has such an impact on all of this,
Right.
then I hope that people, find ways to just, continue to keep doing healthier things. And I'm sure that you teach that, and, ways for people to eat better, healthier, easier, that kind of thing.
Absolutely. And that's one of the key components, is when you figure out these food sensitivities, or figure out the changes you have to make as far as the amount of protein, carbohydrates, and fats you're eating in your diet, it can be very overwhelming and seem impossible. And we have a lot of clients that will come in and be like, I'm afraid to even come and figure this out because I don't know how I'm going to make these changes and still take care of my husband and my kids, or still work a full-time job, or still have the social life that I want to have going out. And that is our goal, is to teach how we can maintain a lifestyle, so a healthier overall lifestyle, but not lose your social events or have to cook 3 different meals for your family. And so, not only going through the elimination, but figuring out what alternatives can be used, figuring out where you can do your grocery shopping, or if you do go out to restaurants, what can you order to be safe? Are there certain supplements that you can take on a as needed basis when you do go out, to help prevent the amount of gluten or dairy that you're absorbing if you have those sensitivities? And that's what, where the work goes into it, and where we help individuals, is figuring that out, figuring out how you can live a healthy, balanced lifestyle and not, feel like you're spending hours and hours in the kitchen or making so many different things. So, but it
Yeah,
is difficult.
I think so. It's interesting. I went through kind of a revamp in what I was doing I started working with a health coach back in January, more so because I was looking to just increase some muscle mass and lose some body fat. I didn't have any health issues or anything like that. but just, the redesign and what he did for my whole, meal plan was uh, it like for the first time I was like, wow, like this is overwhelming. I've never actually experienced that before. I mean, I eat really healthy, but he just wanted me to change things in terms of different macros and, the way the meals went together and that kind of thing. And so, but I found that once I got into it and over the course of a couple of weeks, it absolutely got easier. And in fact, I feel like it's almost easier now than the way that I used to eat because I basically designed like, a week's worth of meals, different things, a couple different things for different breakfasts, a couple different things for different lunches, dinners, same thing. And now it's basically like, I don't even have to think about it. Like, oh, what am I going to eat this week? It's already planned. I'm already in the process of doing it, like the habit of doing it. Like it became my lifestyle.
Sure.
So I'm glad that you used that word because I think that's the way we need to think about it is, okay, this is going to be a big change, but the benefits way outweigh the inconvenience and, the more time, and it gets easier, definitely.
Right. Absolutely. And once you learn the products that you can use, where to find them in the grocery store, the different recipes that you like or don't like, finding the different alternatives, it definitely gets easier, as you learn. Having somebody to guide you on new recipes, things that you can try to give some variety in the meal plan is a key component to it as well. And these days it's much easier with being able to use a grocery store delivery service or Amazon to find some of the products and the snacks that you like to use too. So our biggest thing for our clients is we want them to have the variety. So the different recipes they can use and the different meals they can put together, the snacks they can put together, because it's not a diet. It has to be something that you enjoy doing. So doing chicken and broccoli is horrible for a lot of people, but can we make that more exciting and giving the variety of the different proteins and the vegetables so it is more of a fun lifestyle? And that's the key.
Yeah, exactly. Exactly. So when someone comes to see you, typically like what's the process? What can people expect?
That's a great question. So we will do an initial phone call with the client if that has interest and just learn a little bit about them, tell them a little bit about us, just so we can develop that relationship. That's really, really important for us is having that relationship and the trust initially. We do an initial consultation then either in person or virtually if they're not here local in Naples. So we meet an hour with myself. We do a whole medical evaluation, answer tons and tons of questions again, just to dig a little bit deeper into them. And that really helps me to figure out what kind of blood testing is necessary for the patient, depending on what their goal is, if it is a gut health issue or not, insulin resistant, weight issue, hormonal issue. It gives me an idea of what blood testing could be helpful for us. We then will do an evaluation via blood testing. If the client's had recent blood exam, we may not need to repeat it, but a lot of times we dig even deeper into blood testing than most primary care physicians will. So we'll order the blood testing, including the sensitivity or allergy testing if that's necessary. From there, we typically will work with our clients on a weekly basis to start out for 3 months. We don't kick anybody out after the 3-month period is over, but initially that weekly commitment for the 3 months is really important for us because we're helping them to develop a new lifestyle. And as you mentioned, I mentioned it can be very overwhelming initially. So to be able to have that constant follow-up, the adjustments, the feedback, if they come back and they're like, I was starving, or this is way too much food, or I hated that product, or I need more variety. By seeing them every week, we're able to make those adjustments and really make sure they're happy and successful every week, depending on what their goals were. The accountability factor is huge, especially when it comes to a weight loss type thing, to have that accountability of the tracking. But even, going back to the gut health is we want to be able to track the food and see if we can make some correlations. And again, just continue that fine tuning throughout the 3-month process. After the 3 months, like I said, we don't kick them out. So we'll either continue weekly or go bi-weekly or monthly at that point, depending on where the client is and how comfortable. Certainly repeating blood testing throughout the process process to make sure we're not only seeing subjective improvement, meaning the patient is feeling and looking better, but objectively through the blood test that they are actually getting better and improving. So that's really important for us. It's just the follow-up behind it.
Yeah, I mean, I think the one key thing that you mentioned that stood out for me is accountability. And I don't find that you get that at a lot of with a lot of different practitioners, like in terms of weekly accountability, like that many touch points or check-ins. And interestingly enough, that's exactly what I did with this program that I was telling you about. It was basically weekly accountability. I had to check in every week, whether it was like, how did you sleep this week? Or what the exact things you mentioned. Was it too much food? Were you starving? Were you getting any cravings? Like,
Mhm.
do you not like certain things? I mean, that is just so critical, I think. And absolutely 100%, that's what I credit to my success, because it was knowing that I was going to be checking in with this person every single week and being able to discuss any questions I had or problems I had or frustrations, or even just celebrate like, successes and
The
wins and things like
wins,
that.
yeah.
Yeah. So I think that is huge that you guys offer that.
And it is because, you said the word frustration. A lot of times, if you give somebody a piece of paper and say, here, go do this, and I'll see you in a month, either a month later they're bored, or they haven't lost any of the weight, or their
Or they
gut
didn't do
any
it.
better, or they didn't do it. And so we've just wasted a month and they're frustrated. You're like, what? We wasted a month. So it is, preventing that frustration, making the modifications, the adjustments is huge on that weekly basis. And we actually even check with our clients more than that. We'll text them throughout the week if they are going to a restaurant and they're like, okay, I'm going to Swan River tonight for dinner and I'm not really sure what I'm going to order. We'll tell them, text us where you're going so we can look at the menu and give you back some ideas. So really just having that constant communication is key to their success, feeling better, but overall, improving that quality of life.
Yeah, that is awesome. I can't tell you how many times I've been at a restaurant, and again, like I think I'm pretty knowledgeable, and I look at a menu and I'm like, I have no idea.
No idea.
I'm
Yeah.
like, let me text my guy Chris.
Right.
What should I
Yeah. And
eat? Yeah.
it's so helpful to be able to do that.
Yeah.
And just, have some guidance on what to do, where to go.
Right.
Huge.
Exactly. Exactly. Um, is there anything else that you want our listeners to know about you or your practice, or anything else that we didn't cover?
I think we covered a lot today. I know it was a lot of information and, as always, we're happy to answer questions. So if listeners have any specific questions, we have actually questionnaires on the website that they can go through and determine their risk factor for certain issues like hormone or gut health issues. But there's also little places where they can inquire to have questions answered, and we're happy to do that on more of a personal basis. But really the takeaway message here is we have to treat problems and not symptoms. We have to figure out internally what is going on with your body, your metabolism, whether it is a weight problem or headache problem or a gut health issue, a joint pain issue, an inflamed eye issue.
Yeah.
We just really have to dig deep and figure out where the problem is coming from. It's an investment into your health, but it will improve your longevity. Absolutely.
Yep.
So,
Definitely. Definitely.
yes.
Awesome. Awesome. And remind me, you do see people virtually?
Definitely. Yes, we
Okay.
have lots of, we're in Naples, Florida, but so we do obviously see patients in an office. We have a brick and mortar office, but we do telehealth visits regularly as well. So,
Okay. Cool.
yes.
Cool. Well, thank you so much for being with us today, Jenny. This was awesome.
Thank you. This is
Really.
wonderful. I loved it.
Yeah, I appreciate your time, and I'm sure everybody is fascinated by what we talked about today. You can learn more about Jenni Berman at www.bermanpt.com. That's B as in boy, ERMAN, P as in Paul, T as in Tom.com/wellness, or you can call their office at 239-431-0232. And you can learn more about us at essentialnaples.com. And as I said, Jenny has a great article in our issue that's out right now, the summer issue of Essential Naples. It's on our website. You can also pick it up at stands. And thanks again, Jenny. And thanks everybody for listening to us today.
Thank you so much. Have a great day.
You too.